Hey guys, welcome to my channel, Not Just a Medico. I'm back with another important video of important questions in orthopedics. In this video, you'll get all the important and frequently repeated questions from your previous year question papers. And this includes maximum number of questions. Hence, I can assure you guys that you'll not just pass, but you can easily score distinction in this subject. Only if you prepare thoroughly without skipping any question. And before beginning the video, let me tell you guys that I'm gonna dictate all the questions because there might be few printing mistakes and few questions are repeated several times. So I would suggest you guys that please note down all the questions for your better understanding. And here the questions are given chapter wise which will help you to easily understand. So without any further delay, let's get into the video. As you can see, in first chapter there are no important 10-mark questions. In 5 marks there is only one question, that is CT scan. Now coming to the important 3-mark questions. First question, MRI, Tinel's sign and its significance, Thomas test, carrying angle and its significance, dermatomes and myotomes, CRP, UST in orthopedics, HLA B27, ganglion, Faber test, Coin test, Trendelenburg sign, valgus and varus test, SLR test, and McMurray test. Now, moving on to the second chapter. This chapter contains all the topics that is mentioned in the heading. I'm not gonna read it out. You can check it out for your reference. Now, beginning with the important 10-mark questions. The first one, fracture healing in cortical and cancellous bone. Describe causes and management of malunion fracture. Second one, define fracture, classify features and write about stages of fracture healing and complications. Now, moving to the important 5-mark questions. In this, the first one, reflex sympathetic dystrophy, Erb's palsy, complications of fracture, fracture classification, VIC, that is Volkmann ischemic contracture, myositis ossificans, loose bodies in the joints. Important 3-mark questions, non-union and malunion, pathological fractures, VIC, myositis ossificans, ganglion, simple fracture, name out the surgical treatment of AVN of femur, AVN, fat embolism, pathological fracture, internal fixators, and neurotomesis. That's all about this chapter. Now, moving on to the next chapter that includes fracture and dislocation of upper limb. In this, the important 10-mark questions are the first one, discuss the mechanism, clinical features, radiological features, and management of anterior dislocation of shoulder joint. Second one, 3-part fracture of humerus. Third one, discuss supracondylar fracture of humerus and give its management in brief. Fourth one, describe clinical features, classification, and management of fracture of neck of humerus. Next one, dislocation of shoulder, which includes classify shoulder dislocation, describe mechanism, clinical features, and management of anterior shoulder dislocation. Now coming to the important 5-mark questions. First one, Monteggia fracture, Smith's fracture, clavicle fracture, clinical management of for scapular fracture, explain causes, clinical features of scaphoid fracture, Cooley's fracture, management of recurrent dislocation of patella. Now coming to the important 3-mark questions. First one, Bankhart's repair, complications of Cooley's fracture, Monteggia fracture, Galeazzi fracture, clavicle fracture, complications of supracondylar fracture, Bennett's fracture, scaphoid fracture, Smith's fracture, Barton's fracture, wrist drop, Dupuytren's contracture, Dinefog deformity, trigger finger, Galeazzi fracture, fractures due to fall on an outstretched hand, Kocher's maneuver, and Bankhart's repair. And as you can see, there are few more important 10-mark questions from this chapter, and that includes anterior dislocation of shoulder joint, classify fractures of upper end of humerus, and discuss its management in brief. Now moving on to the next chapter that includes fractures of spine. In this there are no 10-mark questions. Coming to the important 5-mark questions, there are only 2 questions, that is clinical features and management of Hangsman fracture. Second one, rib fracture, its causes and management. Now coming to the 3 marks. First one, Hangsman fracture, complications of rib fracture, Clay-Showler's fracture, head halter traction, SOMI brace, and Potts fracture. And yes, this was quite a small chapter. Now, moving on to the next chapter that includes fractures and dislocations of lower limb. In this, the important 10 mark questions are: discuss the clinical features, investigations, and management of fracture of tibial condyles. Second one, what are the causes, clinical features, investigation, management, and complications of neck of femur fracture? Third one, discuss mechanism of injury, clinical features, complications, and management of anterior dislocation of hip joint. Next one, fracture of neck of femur. Now coming to the important 5 mark questions. First one, patellar fracture, both bone fracture of lower limb, dislocation of patella. Explain the management for recurrent dislocation of patella, posterior dislocation of hip joint, clinical features, diagnosis and management of hip dislocation, recurrent dislocation of patella, foot drop, fracture of calcaneum, blood supply of femoral neck, classify pelvic fractures and its complications. Now coming to the important 3 mark questions. Stress fracture, Pott's fracture, Mars fracture, its causes, Jones fracture, foot drop, its causes and clinical presentation. Next, Thomas splint. In this chapter, there are few more important 10 mark questions. The first one, write an essay on subtrochanteric fracture of femur, its complications and surgical management. Second one, what is dislocation? What are the different types of hip dislocation? Explain the mechanism, clinical features, and management of posterior dislocation of hip joint. Third one, write the difference between fracture neck of femur and fracture shaft of femur. Write in detail about complication and management of both. There's one more important 5 mark question, that is Pott's fracture of ankle. And yes, we are done with this chapter. Moving on to the next chapter that includes soft tissue injuries. In this, there is no 10 mark question. Coming to the important 5 mark questions: ankle sprain, ACL injury, its special test and management, medial collateral ligament injury, classify soft tissue injury, grades of ankle sprain and lateral ankle sprain, cruciate ligament injury and its management, rehabilitation after ACL injury. Coming to the important 3 mark questions. First one, McMurray test. Second one, mechanism and clinical features of ACL injury. Third one, meniscal injury. Fourth one, two special tests for cruciate injury of knee. And yes, this is the end of this chapter. Moving on to the next chapter that includes hand injuries. In this, the important 10 mark questions are: the first one, define amputation. Write in detail about the levels of amputation of both upper and lower extremities, its indications and complications. The second question, discuss various levels of amputation and management of right above knee amputation in brief. Now coming to the important 5 mark questions of this chapter. The first one, crush injuries of hand. Second one, flexor tendon injury. Third one, principles of below knee amputation. Coming to the important 3 mark question, classify amputation of both upper and lower limb. There is only one 3 mark question in this chapter. And here comes the next chapter, but this chapter also includes the same topic, that is amputation. In this, the important 10 mark questions are: the first one, levels of amputation and management of above knee amputation. Second one, define prosthesis and orthosis. Give the pre and post operative management of below knee amputation. Coming to the important 5 mark question, the first one, levels of amputation in both upper and lower limb. And in important 3 mark questions, we have prosthesis used in below knee amputations, gutter crutch, Panthon limb, Jaipur foot. And yes, we are done with this chapter. Moving on to the next small chapter, that is traumatic spinal cord injuries. In this, there is only one 3 mark question, that is SOMI brace. Now, let's start with the new chapter that includes various deformities. In this, the important 10 mark questions are: the first one, discuss classification, clinical features, complications, and management of scoliosis. Second one, explain the terms congenital deformities and its difference from congenital anomalies. Write clinical features, deformities, and management of CTEV. This is the third one. Now, moving on to the next 5 mark questions. In this, the first one, cervical rib. Second one, osteogenesis imperfecta, genu valgum. torticollis, scoliosis, botanist deformity. Explain the surgical methods of CTEV, hallux valgus, developmental dysplasia of hip, congenital torticollis, and CTEV, which is again a repeated question. Now, moving on to the important 3-mark questions. The first one, metatarsalagia, genu recurvatum, coxa vara, Milwaukee brace, mallet finger, flat foot, CTEV, swan neck deformity, hallux valgus, head halter traction. Name the deformities in CTEV. Importance of corpse angle, pes cavus, its definition, torticollis, pes planus and its types. Now, moving on to the next chapter, that is diseases of bones and joints. In this, the important 10-mark questions are: the first one, classify bone tumors and explain GCT. Second one, acute pyogenic osteomyelitis of tibia. Define cold abscess, features, investigations, and management of TB of hip joint. Classify bone tumors, write about clinical features, diagnosis, and management of osteosarcoma. Now, coming to the important 5-mark questions of this chapter. The first one, osteoporosis, Perthes disease, sequestrum, Ewing's sarcoma, osteochondroma. Perthes disease is repeated again. TB of hip, TB of spine, rickets, Brody's abscess, giant cell tumor, and osteomalacia. Now coming to the 3-mark questions. The first one, osteomalacia, osteosarcoma, and mention any 4 clinical features of osteosarcoma. Sequestrum, avian, that is avascular necrosis, Brody's abscess, osteopenia. What is rickets? Clinical features of TB of spine and write about its radiological presentation. What is osteochondroma? Pyogenic arthritis and involucrum. And there are few more important 10 and 5-mark questions. Those are: discuss the etiology, clinical signs and symptoms and management of TB of spine. And in 5-mark questions, explain clinical features and management of osteomyelitis. Explain the clinical features and management of osteopenia. Define osteoporosis and what are the causes and clinical features of osteoporosis. Septic arthritis, involucrum, difference between cold abscess and Brody's abscess. And write in short about the conditions in which they are present. Write in short about the tumors in which onion peel appearance is present. Acute osteomyelitis. Explain the clinical features and management of TB of spine. Osteomalacia, Perthes disease and its management. Legg-Calvé-Perthes disease. As you guys can notice, this question is repeated again and again, hence this is very important question, you shouldn't miss it. And in 3 marks, it is about malignant bone tumors. And finally, we have come to an end of this chapter. Now, moving on to the next chapter, that is inflammatory and degenerative conditions. In this, the important questions are: osteoarthritis, rheumatoid arthritis, describe clinical features, radiological features, diagnosis and management of ankylosing spondylitis. Describe causes, clinical features, complications, deformities and management of rheumatoid arthritis. Now coming to the important 5-mark questions. Rheumatoid arthritis, ankylosing spondylitis, mallet finger, Charcot's joint, causes, clinical features and management of osteoporosis, osteoarthritis of knee, gout arthritis, write about deformities seen in rheumatoid arthritis, and the last one, juvenile rheumatoid arthritis. Coming to the important 3 marks, 4 deformities in rheumatoid arthritis, radiological features in osteoarthritis, gouty arthritis, mention the clinical features of ankylosing spondylitis, gibbous, Charcot joint, 4 deformities in rheumatoid arthritis. And there is one more important 5-mark question, that is explain clinical features and management of rheumatoid arthritis. Now moving on to the next chapter, that is syndromes. In this there are no 10-mark questions. Coming to the important 5-mark questions, the first one, vestibulo-basilar syndrome, and these questions are repeated again. Coming to the important 3 marks, causes of piriformis syndrome. Second one, clinical features of thoracic outlet syndrome. In this chapter there are very few, but these are very important questions. Now moving on to the next chapter, that is neuromuscular disorders. In this, the important 10-mark questions are: the first one, spinal canal stenosis; second one, prolapsed intervertebral disc, its clinical features, management, and complications. Coming to the important 5-mark questions, the first one, cervical spondylosis, its etiology, clinical features, and management. Second one, cervical disc prolapse. Third one, write a short note on management of poliomyelitis. Fourth one, deformities of poliomyelitis and its management. Fifth one, poliomyelitis and its stages. In this is very important question. Now coming to the important 3-mark questions: lumbarization, gibbus, Scheuermann's disease, and yes, we are done with this chapter. Now moving on to the next chapter, that is cervical and lumbar pathology. In this, the important 10-mark questions are: cerebral palsy, its definition, management, and classification. Second one, write in detail about spondylosis, explain about etiology, pathogenesis, clinical features, signs and symptoms with management of cervical spondylosis. Coming to the important 5 marks, poliomyelitis and its stages. As I said you, this is very important question. Not only stages, but in general, poliomyelitis is very important question. The second one, spondylolisthesis, its grades and management. Third one, secondary canal stenosis. Fourth one, cervical disc prolapse. Coming to the important 3-mark questions. Before moving to the 3 marks questions, let me tell you guys that at this point you might feel that these questions are very vast, but trust me, compared to the whole syllabus, these are very less questions. But at the same time, I must say that these are very much enough questions because I have included the maximum number of questions that were repeated in your previous year question papers. And I can even assure you guys that if you prepare thoroughly without skipping any of the questions, you can easily score distinction. Okay, now let's start with the important 3-mark questions. The first one, leprosy and its classification. The second one, what is lumbarization? Now, moving on to the next chapter, that is define arthroplasty, explain total hip arthroplasty. The second one, define arthroplasty, explain the types, indications, contraindications, complications of total hip arthroplasty. Now, coming to the important 5-mark questions. First one, spinal stabilization surgery. Second one, orthodesis and arthroplasty. Third one, hemiarthroplasty. TKR, THR, explain about arthroplasty and its indications and types. Coming to the important 3 marks, internal fixators, two external fixators, complications of THR, arthrodesis, triple arthrodesis of knee, and bone graft. Now, moving on to the next chapter. This chapter is all about regional conditions. In this, there are no 10-mark questions. Coming to the 5 marks, carpal tunnel syndrome, Hoffman syndrome, rupture of Achilles tendon, medial epicondylitis or golfer's elbow, supraspinatus tendonitis, tennis elbow, calcaneal spur, adhesive capsulitis, bicipital tendonitis, student's elbow or olecranon bursitis, Recurrence disease, Osgood Scarlet disease, plantar fasciitis, rotator cuff injuries, piriformis syndrome, Achilles tendonitis, decurvent tenosynovitis, and frozen shoulder. These conditions are very important. Now coming to the important 3-mark questions. Nursemaid's knee, chondromalacia patella, runner's knee, stages of frozen shoulder, pes cavus, plantar fasciitis, trigger finger, bicipital tendonitis, Baker's cyst, plica syndrome, golfer's elbow, mallet finger, flat foot, ankle sprain, housemaid's knee, Morton's neuroma, and calcaneal spur. No, guys, this is not the end. As I told you, these conditions are very important. So there are few more 5-mark questions. Rotator cuff tendonitis, Dupuytren contracture, plantar fasciitis, rotator cuff tear, student's elbow, mallet finger. Explain the mechanism of injury, grades of ankle sprain, and clinical features of lateral ankle sprain. Hoffa syndrome, rupture of Achilles tendon. What is metatarsalgia? Write about its management. Special test of decurvent tenosynovitis. Now coming to the important 3 marks. First one, Dupuytren contracture, metatarsalgia, What are the clinical features of plantar fasciitis? Runner's knee, stages of frozen shoulder, carrying angle and its significance, special test for carpal tunnel syndrome, Osgood-Scarlett disease. Now coming to the important 5 marks. Piriformis syndrome, its assessment and management. Dupuytren contracture, its causes and its management. Anterior knee pain in athletes. Last one, student's elbow. And yes guys, finally we have come to an end of these questions. But wait, before ending this video, let me give you a brief summary of few important topics. As you can see here in patella, majorly we have few important topics, that is chondromalacia patella, fracture of patella, dislocation of patella and patelectomy. And coming to the osteo related topics, osteochondroma, osteoporosis, osteomyelitis, osteopenia, osteoarthritis. Then CTEV and CDH. Next we have TKR and THR, frozen shoulder, avascular necrosis of hip, and TB of spine and TB of hip. These are the major topics which are very important. Next we have fractures and dislocations, anterior dislocation of shoulder, anterior dislocation of hip, defined dislocation and shoulder dislocation in general, and recurrent dislocation of patella. Coming to fractures, in this we have fracture of neck of humerus, subtrochanteric fracture, supracondylar fracture of humerus, shaft of femur fracture, Monteggia and Galeazzi fracture, clavicle fracture, Cooley's fracture, Pott's fracture of ankle, pathological fracture, complications of Cooley's fracture, Smith's fracture, fracture healing, Jones fracture, Bennett's fracture, Hangman fracture, Galeazzi fracture, Clay-Showler's fracture, stress fracture, Barton's fracture, patellar fracture, and shaft of humerus fracture. These were some of the major fractures which you cannot skip. And there's one more question which is related to fracture and that is repeated frequently. That is, define and classify fracture and describe about fracture healing and its complications and stages of fracture healing. And that was all about the important questions. Finally, we have come to an end of this video. So if you find this video helpful, then do not forget to like, share and subscribe to my channel. I'll see you guys in the next video. Till then, take care and bye-bye.